Hello, my name is Chelsey Taylor, and I will be doing my presentation on tinnitus management. My case overview is a 57-year-old male with a sudden onset of tinnitus. He had extremely poor hygiene when we saw him and suicidal thoughts. He reported that his tinnitus was so bad that he couldn't get any type of sleep at night. He also stated that in order to get some type of sleep, he had to take Xanax or morphine or both at times. He also expressed that he hasn't been to work in weeks due to his tinnitus and that he was having thoughts about taking his own life. As for his lifestyle, he did report that he takes care of his 84-year-old mother. However, he has been struggling to take care of her since his tinnitus has come into play. He works for a flower shop. He does not communicate much with others due to his tinnitus, and he avoids friends and family both in person and via telephone. He prefers to be in complete silence. However, even in complete silence, his tinnitus still bothers him. He came for an audiologic evaluation August 2020, which revealed otoscopy unremarkable bilaterally, type A tympanograms bilaterally as well, and normal decreasing to moderately severe sensorineural hearing loss in his right ear, and normal decreasing to moderately severe and rising back to mild sensorineural hearing loss in his left ear. Both ears did have excellent word recognition scores when presented at 70 dBHL. He did deny any pain, drainage, or vertigo. As far as his tinnitus handicap inventory, he did score a 66, which is considered a grade 4, which is severe. As for his intervention, we decided to refer him out to the Spartanburg Mental Health Center. This referral was made to address the patient's struggles with anxiety, depression, suicidal thoughts since his onset of tinnitus. We also did some tinnitus management. We gave him a free hearing aid trial with the tinnitus therapy program turned on, a Sound Oasis tinnitus therapy sound machine to put next to the patient's bed to hopefully put him at ease and let him get some rest at night. His primary goal was to make the tinnitus stop. He also wanted to stop thinking about the tinnitus and how much it has negatively affected his life since it began. He wanted to be able to attend social events such as church, birthday parties, etc., and be able to go back to work. For his treatment plan, we did decide to give him Oticon Ruby 2 hearing aids. We also wanted him to go back to work, so we did encourage him to start going back to work and to just kind of slowly get back into his daily routine prior to the tinnitus beginning. We provided him with different tinnitus management strategies to help mask that tinnitus noise as well, and we reassured him that bringing family and friends along to appointments for support is vital. We wanted to make sure that he knew that he is not alone in this tinnitus journey and that we will not let tinnitus defeat him. As for his outcomes were amazing. He came back into our office after about 2 weeks, and he told us that his tinnitus was pretty much gone and that he doesn't notice it the majority of the day. He did state that he still uses his Sound Oasis tinnitus therapy sound machine for sleeping and during quiet activities to help mask that tinnitus noise. He looked great. He looked like he had better hygiene. He also reported that seeing a counselor definitely helped his mental state, and he expressed that he no longer wanted to take his life, which is also wonderful news. He also stated that he did start back going to church, work, and to other social events with friends and family, and that he was highly motivated to continue to wear hearing aids and to achieve his goals. There were also no further treatment or diagnostic observations needed based on the success of his treatment plan. This case did help me realize that tinnitus can be extremely bothersome for some individuals. I have always been really interested in tinnitus and how it may affect someone. However, I never knew that it could affect someone to this magnitude. During this case, I was able to figure out ways to help him manage his tinnitus. However, I was also able to figure out ways to put him at ease and help him realize that everything will be okay. As an audiologist, it is vital that we take the person as a whole into consideration. And although he came in for his tinnitus, and only his tinnitus, there were other areas of concern, such as his suicidal thoughts, his anxiety, and his depression that needed to be addressed with the help of other professionals. This case did reinforce what I learned in my tinnitus management course and made it applicable to a real-life scenario. Nevertheless, progressing in my career as an audiologist, I will continue to observe patients with a wider scope. Will I diagnose them? Of course. However, I will examine them in totality as well to make sure that they are getting the all-around patient care that they deserve.